You are listening to the Healing Migraines Naturally podcast. I'm your host, Dr. Leslie Caesar, and I'm helping women rediscover a migraine-free life. Today, I'm talking to Mary, who runs our awesome Facebook community, about whether or not you need a different treatment approach depending on the type of migraine you have. Welcome, Mary. How are you?
I'm doing good. I'm very interested in hearing the answer to this question.
Yeah, this is something that comes up in the Facebook group a lot. Would you agree? Like people asking, I have this type of migraine. Have you used this type of medication? Or people searching for a new neurologist so that they can get an accurate diagnosis. Seems like this comes up pretty frequently.
Yeah, I agree. Anyway, I'm sitting here trying to think of all of the different types of migraines I have seen mentioned in the group. And a lot of them are like complicated, medical terms. So I'm not sure if I could even list them. But I know for sure like there's, head injury type migraines, or, people talk about migraines that start from their sinuses or their neck, or like I get vestibular migraines sometimes. So I don't know, maybe you can tell us a little more about all the different types that people see.
Yeah, for sure. Why don't we start with that and kind of go over the different types of migraines? I actually have a blog post on my website that goes over the different types of migraines too, so we can link to that. So the most common type of migraine is the diagnosis would be migraine without aura. And so this is where people have sort of the main symptom would be the head pain. So this is kind of like the classic when you think of a migraine, right? The head is hurting. That would be the most common type of migraine that people have. Some people only have head pain with their migraine symptoms, but more frequently, people will have other symptoms in addition to the pain. So they might have nausea. That's a real common one. They might have vomiting. They might feel real fatigued, kind of brain fogged. That's very common. And then people can have other symptoms that sort of overlap with some of the different migraine types. So people can have the head pain and then they might also feel dizzy, or they have the head pain and they sort of have tingling in the right hand or something like that.
Yes, I've been seeing a lot of questions about like, do you get tingles or numbness in your body with migraines? And I didn't know that was a thing until that question popped up.
Yeah, for sure. So kind of the diagnostic criteria is if you have head pain, you're going to get classified as that migraine without aura, even if you have other symptoms.
So this might be a really dumb question, but how do you know you have a migraine instead of just a regular old headache? Is it the frequency? Is it the magnitude of how bad it hurts? Like what makes it different than a regular headache?
Yeah, so there can be a little bit of a fine line with this, and sometimes people do struggle with a diagnosis. So the diagnostic criteria, so to speak, the classic migraine presentation is that you have the pain on one side of the head. So, and many times it's like a throbbing pain, like a boom, boom, boom. And then it will get better or worse. If you move, then it's worse. Like, so the pain will kind of vary depending on your environment. Like, the pain gets worse if I'm exposed to light. So the classic diagnostic criteria is going to be one side of the head or like one spot, like the right temple. It's like in this area, this is where it hurts. It kind of hurts in a spot, so to speak. And then very typically it's this boom, 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 kind of a throbbing type of pain that will change. The light makes it worse, or the sound makes it worse, or if I bend over, it gets worse. The pain kind of will change depending on the environment. And then many times it will have like the nausea, the vomiting. It's going to have other symptoms, the tingling, right? Versus a headache, the classic headache is going to be like, kind of like my whole head hurts, but it's like a dull ache. And I don't have any other symptoms, right? I'm not feeling nauseous. It's not really pounding. It's more like a dull ache, and it's just kind of there, no matter whether there's light hitting me, whether I'm bending over, and it's just kind of there. The pain is just there, and there's no other symptoms.
What about I know I've gotten the ones where you feel like an ice pick is being shoved through your skull.
Uh-huh.
So pretty when you say it. Like, you can't say that in an eloquent way.
Right. So that's very common with migraines, that people will they'll have more like a stabbing pain, like my eye is being stabbed or somebody's repeatedly stabbing me. That's a pretty common sensation with
Like a
migraines.
migraine. Okay.
But with migraines, it's a complex sort of neurological set of symptoms. So it's more, like I say, occasionally people will just have pain, migraine pain. That's going to be really their only symptom. But more often, people have additional symptoms. The nausea, the tingling, the dizziness. Sometimes people will, they'll yawn a lot, different symptoms, almost, again, not yawning. I'm yawning a lot, not that I'm even that tired. It's like, I just can't stop yawning, right? There's a neurological component to the yawning.
I've heard people have the yawn when they're doing the uh-oh moment. Like they feel the migraine coming on because of the yawn.
A lot of times that uh-oh moment, it's not going to be pain. It might be like, oh, I'm feeling like, one common thing is, oh, I'm hungry. Oh, I need to eat something. Oh, what? If I could, I just need to get something in my stomach. Like people are suddenly hungry. That's fairly common. That could be an uh-oh moment. Yeah, a lot of times the uh-oh moment isn't actually the pain.
The pain, yes. And that's what I was just going to ask you, like, what about, for me, when I get a migraine, usually it's the aura without pain, unless I let it go too long, and then that turns into pain. But it usually is just the visual disturbance for quite a while.
So that is a separate diagnosis. So that's the diagnosis of migraine with aura.
Okay.
So you kind of have, those are kind of the two main migraine diagnoses. The migraine without aura, which is more common, and then the migraine with aura. That is less common. Okay, auras are not as common. And so most situations where people have aura, in most situations, then the head pain will come after the aura. Some people will not get head pain afterwards, but usually people will get head pain after the aura. And usually the aura lasts 20 minutes. That's usually how long it lasts. Also lasts about 20 minutes.
I didn't think I've ever paid attention to how long mine go. I'm like, oh, okay, just hold out for 20 minutes or so. That's good to know.
That's the most common length of time is 20 minutes. It can seem longer than that, but that's usually how long they last.
This is probably another dumb question, but like, do they know what causes the aura? Like, why is your brain going?
Migraines, they really do not understand what kicks migraines off. It's really an unknown pathophysiology. Now, the aura, what's happening is, right, so nothing is actually happening in your eyeball.
Right.
It's all happening in the visual cortex of your brain. So, because a lot of people, right, when you get that aura, I remember the first time I had an aura, right? You think you're having a stroke, you think your retina's detaching, you think, something's happening to your eyes, but nothing is happening in the retina. Nothing is getting detached. There's nothing actually happening with the eyeball. It's all happening in your brain.
So it's basically the way your brain is perceiving or receiving the visual messages.
Well, so what's happening is like a little electrical, sometimes people call it like a storm, like a little electrical storm that's moving through your visual cortex. And this is why the aura is moving, because it's actually moving into different areas of your visual cortex. And so then we perceive that like it's, it started on the right and now it's moving up to the, left corner or something. That's because it's moving through your visual cortex.
I spend a lot of time going, wait, am I seeing that? And why is it moving? Yeah, like it's almost like you're not even sure what your eyes are seeing for a while there.
And so it's a little like the nerves there in that area of your visual cortex. The nerves are firing. It's like a little storm of nerve firing. And then that, like I say, that we perceive that aura, but it's not actually happening in our eye. And, technically, right, the light is coming in and hitting the retina, and then the photons of light are setting off those nerve signals, but all of that goes to our visual cortex, right? We actually see in the back of our brain, even though we think we're seeing with our eyes, right? So when we have that aura, this is why to us, even though it's happening in the visual cortex, it's not actually happening like on our retina or anything like that, but to us, it's our vision. Right? It's indistinguishable from our vision because we're actually seeing in the visual cortex in the back of our brain.
The way our body sees is so fascinating.
Right? Very interesting.
When you say vestibular migraines too, like, is that just another symptom of migraines, or is that a whole other type of migraine?
Yeah, so this is another type of migraine too. So vestibular migraines. So this may not have head pain. And so this, again, it's sort of like a storm happening in the brain that is going through the centers that control our balance. So with vestibular migraines, we might feel dizzy. The room might be spinning. People could have a lot of nausea with that. People, right, the vertigo, the dizziness, the spinning, and then just, that's a horrible, horrible symptom. Most people would prefer pain over dizziness,
I would
right?
agree.
So
I started
very
getting
uncomfortable to
those.
be dizzy.
Yeah, I started getting those about maybe in the last 3 to 5 years. And it was so weird the first few times because obviously I didn't expect it coming. Now I'm kind of like, I know what's going to happen, so I can prepare in a way, I guess, be on guard for it. But yeah, the first few times I woke up and the world was just going in circles and you can't even get your footing. Like you just can't even figure out where you're at in the world.
This is really horrible. And it can be difficult for people to get a diagnosis because sometimes there's no head pain. And then also people can feel like they're having a stroke. You might have felt like you were having a stroke or something, like what's going on here? And so it can be problematic for people to get a diagnosis, proper diagnosis.
Well, and they happen so infrequently that how do you show a doctor what's happening if they only happen once every few months? You're not going to go to the doctor at the right moment when that's happening.
Yeah, it's kind of like you take your car into the mechanic and it's not making the noise anymore, right?
Yes. Or every time you tell your husband your computer won't work, he walks over and everything's fine. It's those moments.
Exactly. So this can be a tough one to get diagnosed. These are, like I say, most people would rather have pain than dizziness. So these are these cause a lot of suffering, those vestibular migraines.
Did we cover all of the types of headaches? I know I sidetracked you with questions.
The other common one is hemiplegic migraine. And so this is where one side of the body is affected. So again, this is happening in the brain. This is all getting kicked off with sort of like a storm in the brain. But so this is where the right side of my body went numb, or my right hand is tingling. People can also have dizziness with this. A lot of times people will not be able to think clearly. Like I lose the ability to say, find names when this is going on. They'll have like a impact with their speech. You can have an aura with this one. That's possible. And this one, you may not have pain either.
This one's the one I think that people talk about in the group as the one that they think they're having a stroke the most frequently.
Yes. Mm-hmm. This one definitely you could feel like you're having a stroke with this one because it's like
if half
one
of your
side.
Body, yeah. And I don't know about you, but that would definitely freak me out.
100%. Yeah, exactly. I think once people, like I've never experienced this personally, but with my clients, I think usually once people get the diagnosis, then they feel a little bit at ease. Oh, well, my hand's tingling, this will pass, and so on. But definitely when it kicks off, it's very, very anxiety provoking for people because people think they're having a stroke.
For sure. Especially if you can't find words, because I don't know. That just makes me feel like my brain short-circuited like 5 minutes ago.
And then you have menstrual migraines. That's very common. People only having a migraine around their period or ovulation. What I see, technically it's a separate diagnosis, but what I see usually when people have menstrual migraines or ovulation migraines, usually they will have additional migraines outside of their period. Not, like I say, not 100% of the time, but usually they will have both migraines, outside of their period or ovulation and the period or ovulation migraines.
So it's more common that they have more types of migraines, not only hormonal.
I would say what is pretty common is people, maybe when they're a teenager, they'll start to get migraines with their period. This is a common way that migraines start. So first the migraines will come with the period only. And then as the health continues to decline, then people will have migraines outside of their period as well. So, by the time people find me, their health has declined usually to that point. But when we go through the history, a lot of times at first, they only had the menstrual migraines.
Interesting. So, side question. I mean, we have a lot of questions about menstrual migraines in the group. Is that caused by hormones, or is it just one of those stressors that tips off like we've always talked about, the stressor that kind of the straw that breaks the camel's back? Is it caused by menstruation and hormones, or is it just an effect of too much stress?
Well, great question. Let's link to the podcast on menstrual migraines where we went over that in detail. I think that's a great point here to link to that. The other type of migraine that's more common in children is abdominal migraine. And so this can strike adults, but usually it doesn't. Usually it's seen in childhood. And again, this is something where the child has this attack of nausea, vomiting. The parents think they have the flu, something like that. And usually there is not head pain, but is sort of an attack that comes on. And so this
Why do they call it a migraine if it's all abdominal? Because I don't know, I guess I always thought of migraines as a head issue, not a body.
Yeah, well, it's a great point. So the differentiation is that if it's being caused by a neurological storm, so to speak. So this can be very difficult to diagnose because, a child, so first of all, a lot of children kind of get that stomach bug. That's kind of a common feature of childhood, the quote unquote stomach bug. And then again, like with migraines, once the storm resides, then the child's fine again, right? They're kind of up and at 'em again. And so if that doesn't happen very frequently, right, it's going to be very difficult to diagnose. Many times parents won't even take the child into the doctor because they just assume it's a stomach bug, something like that. So those are the most common types of migraines. And so people will...
One more?
Yeah, go ahead.
I hear the term cluster headaches a lot too, and I don't understand like the difference between that and a migraine issue. So I'm sure that I'm not the only one that doesn't know.
Yeah.
What is cluster headaches?
Yeah, so this is a very particular type of head pain. And so it will feel like a migraine for sure. And, in my world, these little distinctions, right? This is what we're going to talk about in the podcast. In my world, these little distinctions are not that important. But in conventional medicine, in allopathic medicine, the diagnosis is critical because, like we've talked about in other podcasts, the treatment flows or follows from the diagnosis. So with cluster headaches, these are flaring and remitting like migraines are. There's very, very severe pain on one side of the head. And then there might be other symptoms as well. So people might have like a watery eye, their sinuses might get clogged up. So this can be a little bit harder to diagnose too. A lot of times people will struggle to get this diagnosed properly. But in conventional medicine and allopathic medicine, like I say, the treatment flows from the diagnosis. So if you have, and the treatment is going to suppress the symptoms. We've talked about this before. So when you go into a conventional doctor, their thought process is not to figure out what's wrong and help you fix it so that you don't get the migraines anymore. Their thought process is, what is the diagnosis so that I can prescribe the drug that is appropriate for that diagnosis, the drug that will suppress the symptoms.
There's no cure involved. It's not, hey, we're going to fix this. It's, hey, what can I do to just relieve your symptoms, basically?
Exactly. Because, again, this is not a criticism of medical doctors. In conventional medicine, they don't believe that you can recover your health. Once you have a chronic condition, you can only manage it. That's the mindset. So they're doing what they think is appropriate, right? If you don't think that you can restore your health, you're not going to help anybody do that. If you think once you develop a chronic condition, the only thing that's possible is to manage it by suppressing the symptoms, that's what you're going to help somebody do.
Yeah, I'm going to make a note to link to the show that we did on what your doctor's thinking so people can dive into that if they want to know more about the medical process.
So if you have migraine without aura, most of your symptoms are head pain, they're going to start with a triptan medication because that's what's indicated with that diagnosis. And if you have a lot of nausea with your migraines, they're probably going to give you an anti-nausea drug also, right, to take care of that symptom so that you feel more comfortable. But if you have vestibular migraine and the main symptom that you have is dizziness, well, they're going to have to give a different medication to get rid of that dizziness. Okay. The problem is there aren't a lot of medication that gets rid of dizziness.
I know with me, I have to just hurry and take I don't even know if I say it right, but meclizine, basically.
Meclizine.
Yeah, meclizine. Yeah. Just hurry and pop one and hope it goes away. Yeah.
Exactly. So there are some symptoms. So, like pain, we have analgesic medication, pain relieving medication. So, you have things like naproxen, you have things like Aleve, Advil, aspirin, right? You have things like oxycodone, right? There's a lot of analgesic medications to take pain away. What do you do to take tingling away on one side of the body?
Not a clue.
Exactly. So, like in that case, for hemiplegic migraines, right, where somebody is tingling, well, then you might be prescribed like a benzodiazepine or something like that. Like you might be prescribed a Valium just in an attempt to, like, oh, well, maybe if we take the anxiety down, right? Because again, you're going to feel anxious if you have those symptoms. So maybe if we take the anxiety down, that would help this. But some symptoms, they have drugs that are fairly effective at suppressing that symptom. And then sometimes they don't have drugs that are very effective at all for certain symptoms. Like I say, when you go into the medical doctor and they're looking at how do we suppress this symptom, we have to get the correct diagnosis for that. And then you may or may not have a lot of options as far as drugs to suppress those symptoms. Like the other thing too, so let's say you have vestibular migraines and your main symptom is dizziness. Well, a lot of people go to an ear, nose, and throat doctor because, there's something wrong with I'm dizzy. This must be something wrong with my inner ear. And so then they're going to ear, nose, and throat. A lot of people will have sinus pain with regular migraine without aura. Sinus pain is a real common feature. So then they might go to the ENT. They're getting MRIs of the sinuses and they're antibiotics for a presumed sinus infection because there's pain there.
And we've talked a lot before about the process you go through is often very involved. How many tests, how many blood draws, how many x-rays, how many MRIs. And then you come out with really no clear answers, which is almost more frustrating than when you started. You just want an answer so bad.
So if you have been misdiagnosed, you are not going to get the particular medication to suppress your symptoms. So this is where in conventional medicine, getting the right diagnosis means getting different meds, which may be more effective at suppressing the symptom. So like, for example, let's say somebody has hemiplegic migraine. Like I'll give an example. Okay. So somebody has these episodes where they're feeling this tingling on one side of their body. And so they go into the doctor. Well, the doctor might assume, you know what? I think you're having a panic attack, right? Because with panic attack, we could feel numbness and tingling. That could be a feature of a panic attack. And so particularly, right, if there's no head pain with the hemiplegic migraine, it's just the numbness and tingling, the doctor might say, this is panic attack. So then they would give an anxiety medication, let's say. Well, that's not going to really suppress that tingling. So if somebody were to, quote unquote, correct diagnosis, then they would be given other medication. So let's say maybe they would be given then gabapentin or nortriptyline or something like that. That would be something that is more suppressive of numbness and tingling.
Which I know a lot of our migraine group, our migraine sufferers, they feel very invalidated when it's assumed to be an anxiety or depression or anything quote unquote in your head.
Right, exactly.
I hate the term "it's all in your head" because I'm like, well, yeah, of course it is. Where else would it be? Migraine start in the head, whether you want to believe that or not.
So this is why, a lot of times people will be searching out for maybe a more expert neurologist, or they want to go to a university medical center or something like that because they're kind of searching, do I have the right diagnosis? Because from there, I'm going to get different medication to suppress the symptoms. So to answer this question for this podcast, right, do different types of migraines require a different approach? If you're going to suppress symptoms, yes, you're going to need different drugs to suppress different symptoms. Now, in my world, the type of migraine the overall problem is the same. So whether somebody's getting an aura, whether somebody's having vestibular migraines, whether somebody's, quote unquote, just having migraine without aura, whether somebody has headaches. So it's very common. People will have migraines flaring, but then they'll have headaches as well. That's very common. If somebody has menstrual migraines, somebody has cluster headaches. The underlying issue is that the person is not in a state of health. And the answer to the problem is to restore the health so that the body doesn't generate those symptoms. So for me, the particular type of migraine that's happening is not that relevant to what I do. Okay, because the fundamental problem is that, we're not in a state of health. And how do we restore our health? Well, there are 3 things that we have to do to restore our health. And I call these the 3 principles. So the first principle is we have to get the nutrients to every cell in the body. The second principle is we have to clear metabolic waste material. And the third principle is we have to restore our resiliency and vitality. So those of you that have been following the podcast, taken some of my free trainings, you've heard me talk about these 3 principles that are required to restore our health and maintain our health. It's not like we achieve health and we never leave health, right?
That would be nice.
Right? Health is not a destination that we never leave. Health is something that we are constantly kind of going in and out of. Some days we feel better than others. So regardless of the diagnosis, my underlying approach is going to be the same. So we have to identify, okay, if somebody's not feeling well, if somebody has migraines without aura, if they have vestibular migraines, if they have menstrual migraines, they are going to have missing pieces, blockers, deficiencies within those 3 principles. That's a given. We know that because they're not feeling well. So the question is,
the approach that you take is going to be the same no matter what specific type of headache, migraine, etc. that people have.
The underlying approach is going to be the same because there's going to be like that. Now, the particular like blockers or missing pieces or deficiencies, those are going to vary, person to person. But we're going to see blockers or deficiencies or missing pieces within those 3 principles. That's a given. So then the question is, what are they for you? And then how are we going to address that? The best way for you to do that. So that's, how we would even address that would be different person to person. So, if I'm working with somebody that works 3rd shift, has a job where they're working 3rd shift overnight, it's going to be a different set of solutions than if somebody works 9 to 5 because their environment, their whole schedule, et cetera, is very different. And so the actual way we're going to kind of fill in those missing pieces or deficiencies, that's going to vary person to person. But the universal is you have blockers, missing pieces, or deficiencies within those 3 principles if you have any of these diagnoses.
So it's not like the approach is the same, but it's not a cookie cutter approach for everyone.
So people will ask me, well, do you work with people with, auras? Do you work with hemiplegic migraines? Yes, I work with all of those things. I work with people that, quote unquote, just have headaches. If somebody can have chronic headaches, right, that maybe don't rise to the diagnosis of a migraine, you're still suffering and you still have deficiencies or missing pieces or blockers within those 3 principles if you have daily headaches. So I think this is a critical shift, right, in our mindset, right? We are very much focused on like, what is the diagnosis? What exactly do I have? Well, all diagnoses are made up by humans.
We used to say in psychology, in my psychology school, it's just a word to describe a group of symptoms. That's literally what it is you're just giving a label to a group of symptoms.
Exactly. Now, the body generates symptoms within certain patterns. This is why we can identify certain patterns. And so over the course of time, over the course of the practice of medicine, doctors, nurses, professionals have noticed these recurring patterns because the body, things in the universe are not just random. There are patterns. There are laws to the universe. There are recurring patterns, right? Things are not just randomly happening. There are patterns. So we also exhibit these patterns. And so what we humans have picked up on is we have observed different patterns. And then we kind of say, okay, if you have all of these things within this pattern, you get this diagnosis. Right? If you kind of check these boxes, if you check 5 out of these 7 boxes, then you have enough of the pattern happening. Then we call it this. We call it migraine without aura.
Well, sometimes, like, I think just having a name to call it is comforting in a weird way, knowing what to call the pattern or the symptoms.
For sure. And it can be very comforting if we know, okay, the diagnosis isn't stroke. Like with an aura, right? It can be very comforting to be told, yeah, your retina is not detaching here. So that, yes, absolutely, that can be very helpful. But then the question is, okay, what next? What are we going to do next? And this is where we have a choice. Are we going to suppress the symptoms? And that's all we do? And do we just manage the symptoms for the rest of our life? And as they continue to get worse, we have to use stronger and stronger stuff to manage them? Or are we going to take the path where we identify, okay, what are the missing pieces? What are the blockers to me being in a state of health? And then can I fix those? So very good. How do you think we did, Mary? You think we covered it?
I do. I feel like there's 1,000 more questions that we could go into, but I'm sure we will eventually. And there's, how many episodes is this? We're on, like, 21, I think.
I don't know.
20 or 21. Anyway, there's also 20 more episodes that cover a lot of information. So, I feel like we just dip a toe every time we have a conversation.
I know, right?
There's so much to know, so much to learn.
There is. So very good. I hope this was helpful to folks. And like I say, getting the diagnosis, that's great. But now what are we going to do? Right? What are we going to do with the diagnosis? And again, we kind of act like these diseases, like they just kind of fell out of the sky and fell on us. Oh, one day, migraine without aura, that just kind of fell on you, right? The disease, right, it doesn't technically exist. What exists is our body is generating these symptoms. The body will generate things within certain recognizable patterns. But there's, right, in the universe, there's no entity called migraine without aura. That's our human brain kind of recognizing patterns and putting a name on patterns.
And I think that it goes back to like you've said before, it's a signal that something's wrong in the body. It's like you said, the true north your needle isn't where it's supposed to be true north. And it's a signal that there's something wrong or going wrong and we need to address it. I've always really appreciated that analogy because I'm like, now instead of, being afraid of a vestibular migraine or, an aura, it can just be like, oh, okay, something's off and I need to figure out what it is rather than, go into panic mode about it.
And with these diagnoses, we can become very almost invested, kind of our identity almost. When I was starting in naturopathic medical school, one of our teachers was kind of like an elder doc and had been in practice for a long time. And he shared a story with us. This was at the beginning of my naturopathic medical school education. He shared a story with us. So he had 2 new patients that started right around the same time. And they both had the diagnosis of lupus. And, he had worked with lupus before. He had had great success with lupus in the past. He was very eager to help both of these women turn their lupus around, get that lupus in remission. Basically, you can turn that around so you don't have any symptoms that we call lupus anymore. And so he's working with both of them, definitely, individualized approach for both of them. But one of the women got better very rapidly and went into total remission, was no longer had lupus, no longer fit the diagnostic criteria for lupus. And she kind of went on her way. And the other woman, not everything he did, nothing responded. And he was, studying the case and racking his brain and, really, really working hard to serve this woman. And one day she was the last appointment of the day. And he finished the appointment with her and she left the office. And then he, within a minute or two kind of closed up and left the office as well. And the woman was in the parking lot talking on the phone in her car. So she, was still in the parking lot. And he noticed her license plate. Her license plate was a vanity license plate, and the license plate said lupus. And so the next time she came in, he said, "Oh, I noticed your license plate. It says lupus." Oh yeah, she was like the founder of like a lupus support group. So, we'll never know for certain what happened in this case, but you have to question, right? If somebody has their license plate that says lupus, what happens when you no longer have lupus? So this is where we don't want to take on this identity of our diagnosis. We are not our diagnosis. The diagnosis is just a little label that's put on a recurring pattern of symptoms that have been seen across different human beings. But we don't have to carry that with us, right? If we can get the missing pieces in place, right, we can restore our health. And when we do that, then we don't have the diagnosis anymore. So this is a really critical piece, right? We don't want to make a diagnosis our identity. Diagnosis is not our identity.
And I think that you hear that even in people, the way they talk, like my migraines are out of control. Like it's almost part of like they own those migraines rather than I'm suffering a migraine right now. It's my migraine. It's like an ownership thing. It's really interesting.
So, like I say, these diagnoses, they serve a purpose, but we want to make sure that we are treating them in the way they should be treated, not as an identity, but as a label, to kind of put a name on a pattern of symptoms that can go away.
Such a shift in perspective, because I'm 99% sure that with the way we've been taught in traditional medicine, and which is what most of us are exposed to through our lives, that there is no way to get better. There is no cure for so many things, right?
Right. I mean, there are some migraine Facebook groups where you are not allowed to post that you're feeling better because that goes against, our migraine Facebook group has a very different feel than most other migraine Facebook groups, right? Because most migraine Facebook groups, it's, we're here to support each other as we labor under this horrible thing that fell out of the sky and it attached to ourselves, chronic migraine, because that's the only thing we can do is support each other. No, that's not the case. We want to get out there and we want to determine what are the blockers, the missing pieces, the deficiencies within these three principles, and what can I do to correct it? That's what we want to focus on, not this temporary diagnosis.
And I just think it's a good time to mention that in the group, we don't suppress people talking about their medical journey either. Like,
for sure.
It is not good. Like, it's a natural group, but everybody is at a different place in their journey. So we don't penalize them for mentioning Botox. We try to educate people, like you're adding more toxins into your body, which is actually going to end up making it worse. But we're not going to take that post down because everybody is at a different place in their journey. And we're not going to penalize people for where they're at.
Correct.
Just in case people see the unnatural posts in the group.
Absolutely.
I get comments about that every once in a while. I'm like, okay, it's because we're not in the business of telling people to shut up when they're experiencing what they're experiencing.
Yeah, when they're looking for information, for sure.
Anyway, all right.
Well, very good, Mary. Thank you so much for joining me again today. Appreciate it.
Awesome. We'll see you guys soon.
We'll talk to you soon. And thank you for listening. Before you go, be sure to like this episode and subscribe to this podcast. You can find us on Spotify, iTunes, and other popular podcast platforms. Do you have someone in your life who would benefit from what we talked about today? Please share it with them. Share on your social media. Share within other migraine Facebook groups that you are in. We really want to get the word out that you can recover your health and stop getting chronic migraines. And if you want to stay connected, join my free migraine Facebook group with over 11,000 women who are rediscovering a migraine-free life. Go to Healing Migraines Naturally with Leslie Caesar, ND, on Facebook, or to healingmigrainesnaturally.com and we'll redirect you to the Facebook group.